This call from the ER doctors is on the same day the state health department and Virginia hospitals asking people to avoid the ER if they're just looking for a COVID test or treatment for mild COVID symptoms or another non-serious illnesses. The ER physicians group saying while they support this statement, they don't want to scare people away from the emergency room and instead want more tools to help them.
We have shattered every volume record that we've had in our ERs over the last week.
Dr. Todd Parker describes his life as an emergency room physician on the Eastern Shore as the Omicron variant drives a surge across Virginia. And as president-elect of the Virginia College of Emergency Physicians, he says he's not alone.
The volume of patients is crushing. It is overwhelming the ERs right now.
He says while hospitalizations and ICU beds taken up by COVID cases is not at its highest, ER rooms are seeing an influx of very ill patients, those seeking treatment for minor COVID symptoms or a COVID test and have nowhere else to go.
They can't get in to see primary care offices. They can't get in to see urgent cares, and really the emergency department, as we frequently are the safety net.
So on Thursday, the group put out a statement calling on the state to provide more help, including for Governor Ralph Northam to reinstate a state of emergency.
It allows us some options that aren't normally allowed.
They're also asking public health officials to set up more testing events to alleviate that pressure. The request comes only hours after the Virginia Department of Health and Virginia Hospital and Healthcare Association put out a joint statement asking people seeking testing or have mild COVID symptoms or other non-serious illnesses to avoid visiting the ER. VDH officials spoke with CBS 6 about this before the VACEP statement.
For general testing needs, please do not go to the emergency room or burden the hospitals any more than they really are. They are ready to serve those that have severe illnesses, so we definitely need to preserve that.
The same official says they're working with local health departments to increase the number of testing events. For his group's part, Parker says they support the VDH-VHHA statement, but wanted to put out their own as they don't want people to be afraid to come to the ER, pointing to the impact that had early on in the pandemic.
The downstream effects of that were terrible, with people having serious health conditions that could have been taken care of had they been seen sooner.
Meanwhile, the governor's office in part pointed us to his statements yesterday, encouraging people to avoid unnecessary ER visits and encouraging people to get vaccinated. They also added that while hospitalizations are at a lower rate than they were during the last spike driven by Delta, and they say regarding this request, they have just received it and are reviewing it.